First of all, I am not a doctor. I have been on a continuous healthy lifestyle optimization search as I age, now 86 years old, by navigating, exploring, and selecting both medical and homeopathic options to maximize my health, happiness, and stability of my lifestyle. I believe that individuals must assume the primary responsibility for managing their health. That is, as opposed to one's continuing to do what they have been doing, good or bad, right or wrong, while passing on the responsibility for the management of one's health to the medical community. I have found that medical prescriptions often have side effects that are worse, far worse, than the medical condition one is trying to solve. The audio of this video and text narrative with minor text deletions in an effort to stay on point is reflective of both personal experiences, research of medical journals, and a wide range of current and historical YouTube ciprofloxacin history, definitions, conditions, and management solutions. This alert is but one example of many types of medical malpractice prescriptions that prey on the uninformed, the lazy, the naive, and the unsuspecting. You will get what you settled for. If you are currently a victim of taking ciprofloxacin, Cipro, or if you are in the process of starting a ciprofloxacin prescription, stop. Stop. The life you save might be your own. Ciprofloxacin 500 milligrams is a strong, broad-spectrum antibiotic that fights a wide variety of severe bacterial infections in the urinary tract, lungs, abdomen, and bones. To define, not to whine or to complain, but only with the hope of saving someone. Briefly, I recently had my annual cancer CT scan. No cancer. Almost as a footnote, at the bottom of the CT scan report indicated a urinary tract infection, UTI. Not a big deal, unless left untreated, as I had scheduled a UTI appointment with my primary care physician. At home, I received a call from a staff member of my CT scan oncologist indicating the presence of a UTI and that she could send me a prescription immediately. Why not? I'll get to why not in a moment. Picked up prescription, took one dose, took another dose as prescribed later in the day, took another dose in the morning. It did not feel well. Stopped 14 dose, 7-day prescription immediately, knowing that something was wrong, very wrong. Serious warnings, nausea, tendon nerve, central nervous system eruption, and a complete loss of the use of my left arm. Cannot lift my arm without using my left arm for support and lift. A sudden loss of all arm strength while taking ciprofloxacin is a severe, potentially disabling medical emergency that requires you contact your prescribing doctor or seek immediate medical attention. Ciprofloxacin carries prominent FDA boxed warnings because it can cause profound neuromuscular block, severe nerve damage, peripheral neuropathy, and structural tendon injuries. Symptoms worsening, I went to hospital emergency, doctors concerned about a prelude to a stroke, CT scan, no issues other than the fact that it was clear that ciprofloxacin was and is the cause of my current condition. When a prescription is prescribed, UTI protocol requires, sidebar, skip a step, or in her case, skip all steps, proceed at certain greater risks and consequences. Patient profile, patient medical history, prescription history, urine sample to detect bacteria type, side effects, black box warnings, contraindications and interactions, red flag before prescribing a medication to a patient, none of which were considered by the provider, and most of which are the root cause of my current medical condition. If she had just taken but a moment to consider the protocol, she would never have issued a UTI prescription. Side effects: tendon damage. Ciprofloxacin can cause inflammation or rupture of tendons, most commonly the Achilles tendon, which may happen even months after you stop taking the drug. Nerve damage. Peripheral neuropathy, numbness, tingling, or burning in the hands or feet can occur. Medical news today. Mental health and central nervous system effects. Rare but serious reactions include hallucinations, severe confusion, paranoia, and seizures. Severe diarrhea. Ciprofloxacin can trigger a severe intestinal infection, resulting in watery or bloody diarrhea. Heart rhythm. It can cause a heart condition known as long QT syndrome. Black box. Before recommending or prescribing a medical prescription with an FDA black box warning, a doctor must perform a strict risk-benefit analysis, rule out safer alternatives, thoroughly counsel the patient on specific life-threatening risks, and establish a clear monitoring protocol. Myasthenia gravis. Ciprofloxacin is strongly discouraged for people with myasthenia gravis because it carries a U.S. FDA black box warning for exacerbating severe muscle weakness and breathing problems. Doctors must avoid prescribing antibiotics like Cipro to patients with a known history of this condition unless no alternative treatment exists. Risks and warnings for myasthenia gravis. Muscle weakness can trigger sudden severe drops in muscle strength within 1 day of starting the medication. Breathing difficulties may cause life-threatening respiratory depression or trigger a myasthenia gravis crisis. Black box warnings. Official federal safety alerts highlight that the risks heavily outweigh the benefits in neuromuscular conditions. The prognosis. Immediate steps to take. Never, ever, never accept or take a prescription of any kind without first knowing each of the protocol essentials. Be sure there are no benign, yet more, or equally effective alternatives. No exceptions, period. Timeline. The timeline and baseline for your recovery depends entirely on the underlying biological cause of the weakness, which a doctor must diagnose. Neuromuscular exacerbation. If ciprofloxacin triggered unmanaged neuromuscular issues such as myasthenia gravis, the prognosis is typically acute but reversible. Once the drug is completely cleared from your system, muscle communication usually restores, though you may require targeted medical support during clearance. Peripheral neuropathy, nerve damage. If the drug has caused direct damage to the peripheral nerves controlling your arms, the prognosis is variable. Nerve healing is famously slow. While many people experience a gradual return of strength over several weeks or months, the FDA warns that ciprofloxacin-induced nerve damage can sometimes be long-lasting or permanent. Mitochondrial or cellular toxicity. The drug can damage cellular mitochondria and soft tissues. This prognosis involves a slower, multi-month recovery curve requiring dedicated physical rehabilitation. Nutritional and supplement support. Under medical supervision, clinicians often utilize specific antioxidant therapies like CoQ10, magnesium, and vitamin E to counter cellular oxidative stress and to help restore damaged mitochondrial function. Neurological evaluation, EMG, or nerve conduction studies can pinpoint exactly where the signal is failing between your central nervous system and your arm muscles, allowing for highly targeted neurological rehabilitation.